Now from Mayo Clinic, it's Medical Edge Weekend, the only show that gives you the chance to ask your questions to Mayo Clinic experts. Plus, we'll take you beyond the headlines for in-depth discussions of what developments in medicine mean to you. Information you want from specialists who know. Join the conversation by phone, through our blog, or on Twitter by going to radio.mayoclinic.org. Now, with this week's program, here are your hosts, Dr. Tom Shives and Tracy McCray.
From the Mayo Clinic, Rochester, Minnesota campus, I'm Dr. Tom Shives.
And I'm Tracy McCray.
Welcome, everyone, to Medical Edge Weekend. And we're going to go to Mount Everest, correct?
That's where we're headed. I believe that they're there. Good morning. Dr. Johnson, are you there?
I am. Hi, Tom and Tracy. How are you?
Hey, good. Nice to hear from you. How's the team?
Well, the team's wearing out. You know, we've been working pretty hard for a couple weeks now, and between the altitude and other little bugs and long days, I think it's getting to them a little bit, but they've been working very hard, and we've collected pretty much all the data we intended to, and we're getting ready to pull up shop and head back down towards civilization.
You are part of a team of researchers who are on Mount Everest. And tell us the purpose of your expedition. Why in the world are you at Mount Everest right now?
Well, our lab, which is part of Mayo Clinic, has been interested in human physiology in extreme environments. And one major focus of this study is on lung physiology and lung fluid regulation. Because one of the problems at high altitude is the development of high-altitude pulmonary edema. And there's still a number of controversies out there. And we brought with a lot of medical gear and essentially set up a remote lab up here at Everest Base Camp and are testing some of our hypotheses around lung fluid.
So what you're saying is that the climbers, now you are at base camp, so you are at about 18,000 feet, but you have climbers with you who are sort of your models or your subjects or the people that you're studying, and they climb all the way up to the top. And it's interesting that climbers have some of the same symptoms or develop some of the same symptoms as people with heart failure, and that is shortness of breath, and you said pulmonary edema, which means fluid on the lungs, correct?
That's correct. And back in Rochester, we also have been studying pulmonary congestion in the heart failure patients, and we think, some of the mechanisms are similar, and so we can use similar techniques to study this.
So you have mentioned that your research is pretty well done, and when can we expect some results from what you've studied?
Well, we've collected a lot of data. We are hoping to get some of our initial findings out over the next several months. But some of the data we've collected is very extensive, and will take probably 6 months to a year to analyze.
Now, the word back here is that this trip has been a little bit more difficult than you thought. What's been the biggest challenge for your team?
Yeah, well, to get to base camp, it's a long trek in, and we had about 600 kilograms of equipment, which went on the backs of porters and yaks. And so it's the trek in. You're acclimatizing as you're trekking in, and we're also trying to collect data as we're making our way in. So there's other challenges regarding power. We have generators with us. We have solar power, but there are spikes and surges that affect our equipment. And then we also have huge temperature swings during the day. And, when the sun comes out, there's a lot of solar radiation, and it heats up the tents, but when the sun goes away, the temperatures drop dramatically, which affect our equipment. So those are some of the challenges.
I've been stunned, Dr. Johnson, that I've been seeing updates from your colleagues, our colleague Joel Streed, who is helping with this, that he is updating his Facebook page. He's sending us emails telling us what's going on. What is the Yak a hot spot for Wi-Fi hookup, or how is that even possible? You're on Mount Everest, for heaven's sakes.
Yeah, well, getting cell coverage and internet is a challenge. We have a BGAN system that's satellite-based for some of this, and it's just one of the challenges of being here in a field environment.
Well, we'll look forward to hearing more about it when you return to the United States. Hopefully you'll schedule some time to come and talk with us on Medical Edge some Saturday morning.
And that would be great.
Thanks so much, Dr. Bruce Johnson, leading an expedition of Mayo researchers studying heart failure on Mount Everest. Best of luck to you on the trip back home, Dr. Johnson.
All right. Thank you very much.
All right. Exciting stuff, huh?
It's nerve-wracking to follow them, actually. The first day they woke up and said, we had an avalanche spray hit our camp today. I thought, I'm glad I'm not in their shoes. But it's very exciting, and I'm really anxious to hear more about it when they return.
Yeah, and the glacier that they're on has moved some 5 feet while they were on it. I bet Joel Street is ready to come home, don't you?
I think our first staff meeting upon his return is going to be dominated by stories, war stories. I'm sure of it.
For more information, please go to our website, radio.mayoclinic.org. Please join us each week on this station for more of the medical information you want from Mayo Clinic specialists who know.